And I will say good evening to all of you and welcome to OTF Connect. We're particularly excited tonight that we are branching into a new area of professional learning for educators across Ontario. We're introducing a series of webinars on the topic of mental health and wellness. So we're very excited to kick this off tonight with Dr. Sagar Parikh and Kathleen Q, who are from Mensante Corporation, and they're going to tell you a little bit more about that as they get going. In case you were late to join our group tonight, I will just say that Kathleen is listed in the participants list as a moderator. Dr. Parikh is not, but he is certainly going to be a valuable part of our presentation tonight. But he is attending at a distance and he's using his tablet. And as on a tablet, I'm unable to grant him the same moderator privileges as you can do on a desktop computer. So we will hear from him, and we'll be able to communicate with him through the chat and through everything else, but we just don't see his name listed as moderator. So I will turn things over to them. A warm welcome to all of you educators from across the province, and particularly to Kathleen and Dr. Parikh. Welcome.
Okay, thank you very much, Susan. Thank you everyone for having us here today. It was OTF that reached out to us looking for some more information about mental health and a mental health webinar. And what we're going to do is Dr. Parikh and I will share a bit of our expertise. We'll walk through Feeling Better Now, the program that you already have access to. And of course, it's going to be interactive, and you can ask any questions you'd like at any time. So first off, I did notice that there is a polling function on Blackboard Collaborate. We're going to have the questions up, but we also have a separate website that has this poll for you. But I think just keep things simple. We're going to test out a few of these little features that Susan has shown us. So we might just use a clip art to see how people feel. So you don't have to go onto this website for now. We'll see how it goes with just the features we have on Blackboard, which are quite extensive already. So before I turn things over, I'd like to introduce Dr. Parikh and myself. Of course, I'll let him introduce himself instead. I'm mainly the product manager for Feeling Better Now, and my background is in global health and knowledge translation. So being able to really turn evidence-based research into practice and apply that to daily life instead of letting it kind of sit in an academic library. Now, Dr. Parikh, are you able to turn on your mic and speak, or do I need to give you permission or something?
Well, let's try this. Can you hear me now?
Yep, perfect. Okay, go ahead and just let me know when you want me to switch the slide.
Okay, well, welcome everyone. And what we hope to do today is to talk more broadly about issues around mental health in the schools a little bit, and then show you something that is a made in Canada innovation, where we're really trying to use 21st century approaches to mental health. And I am a Canadian psychiatrist. I recently moved to the United States, but I keep active. Most of my career has been in Toronto, and I can say my mom was a primary school teacher in Brampton, so I think I have some connections here. If we could have the next slide, please. So what we hope to do today is look at just a few of the sort of headlines about mental health, touch on some attributes of mental health challenges in the educational environment, and think about barriers when people have mental health problems. You know, what are some of the barriers to access and care? And one solution to that, one of many solutions that will be necessary, is a technology-based approach. And the particular technology we're going to talk about today is called Feeling Better Now. And we're going to just explain what it is and then walk you through it because it's already available to you. Next slide. I'll let you read. One issue with these kinds of webinar presentations is I have no idea what you're saying in the background. You may be groaning or you may be laughing. So that is contributing to my stress. Next slide. So mental health, what do we really mean? The traditional understanding, especially from a medical perspective, is that we are, doctors in general are trained to look at and look for mental illness or illness more broadly. But these days, what we're thinking about is, how can we all do better for ourselves, our friends, our families, and so on. So that's where, wellness, and you keep on hearing this word wellness coming in. But so the World Health Organization has tried to operationalize this, and here are a couple of their definitions. So the idea of mental health is it's a state of well-being where we can all achieve everything we want to achieve, academically, socially, creatively, and so on. Next slide. Okay, so Kathleen, I'm going to turn it back to you because I'm not sure exactly how you want to do these surveys.
Right. So what we can try with this survey here is, Susan did mention there were clip art. So for those of you who are on the computer, please put one of those clip art check marks next to the bullet that you think answers the question best for you. And for those who are not able to do that, please type it into the chat box. So we'll give you some time for this. And it's just good to see where everyone really stands. And I'm sure Dr. Parikh will be able to speak more on that.
Yeah, and just a reminder, if you're wondering where the clip art is, there's find the section where it has all the names, the so-called main room, and just to the right of that is a tab with a whole bunch of different symbols, and at the bottom of those symbols is the clip art button, and you just press on that and select your clip art.
So we'll give a few, maybe another minute or so. And if you don't have that clip art function, you can always type it into the chat box. Thank you. If it's possible to put multiple symbols on, yes, you can definitely check off multiple boxes. And Dr. Parikh, whenever you're ready, I think this is about half of our participants, and if you don't feel like taking a poll, there's no pressure to do that either.
Well, I think it takes a while to learn. It took me a while to figure out how to drag the icon out of the button. So I think people just, for this very first question, people need to get comfortable with pulling things over. And in the interest of democracy, I decided to put an icon over the very top thing, not at all, because I figured no one else would.
That's great.
Okay, and I see that the chat room is working well.
Yeah, Helen, to clarify by box, it just means any of the points that are listed. It doesn't, we don't have an actual check box, but as people have been putting the symbols next to it, we have an idea of where people stand on this question and how it is related to them.
All right, so why don't we just take a look at this for a second. Obviously we're not identifying anybody, except I volunteered that I'm the funny guy who put the arrow at the not at all. As a psychiatrist, I don't know anyone who has a mental health problem. Okay, so we see that where the majority of the tics are you know, well, actually it's fairly even for the bottom three, it seems, and the second one down, I know of someone, has a fair number. So it's clear that there's no one really in the category of not knowing anybody. And I think this really speaks to the ubiquity of concerns about mental illness. Next slide. So this is another way of saying just how ubiquitous are these problems. If we look at it from a purely statistical perspective, you know, we might say 1 in 5. But what I like is another way of looking at statistics, which is something maybe affecting 1 in 5, in that 1 person out of 5 may have a mental health condition at some point in their life, but it touches and impacts 5 out of 5, or all of us. And this is a problem in every culture, in every setting, in schools, in the workplace, in the home. And, you know, apart from the direct suffering that mental illness might create, you know, on behavior and emotions, mental health problems also worsen physical health problems. People with depression and diabetes have worse blood sugars. People who have heart attacks and then have clinical depressions, if you don't treat that depression after having a heart attack, you're actually more likely to die than any other cardiac risk factor, such as like being a smoker or something like that. So it's an important problem. Next slide. You know, does this approach to mental health make a difference in the brain? Actually, increasingly, we're understanding that there are subtle changes in the brain related to mental illness. This is a particularly dramatic example. This is a picture of a brain scan, and on the left is a healthy brain. On the right-hand side is the brain of someone with bipolar disorder. And this is a very dramatic picture, but there are more common pictures which show a smaller shrinkage of the brain related to untreated mood disorder. So there are specific areas of the brain that shrivel up if you persist for a long period of time, years, with an untreated mood disorder. So it matters not only in terms of suffering, but it matters in terms of actual brain tissue to get treatment. And treatment doesn't always mean medication, but it means whatever works to fix the depression, including exercise, psychotherapy, and so on. Next. So what about teachers? And I know because of this, the nature of this, we're not allowing you all to chime in, but I think many of you would understand these kinds of statistics. 2/3 of the teachers say that their job is wearing them down. Stress is ubiquitous, and for teachers as well as for all Canadians, depression in particular is the #1 cause of disability. So more people are off work because of depression than because of cancer or heart attacks or things like that. And here are some other statistics that are particularly dismaying, and I really lament the final one. At least 30% of teachers leave the profession within 5 years. That's very disheartening when you think of all the work and how valuable teachers are to the health of our society. Next slide. Now, another perspective on the interaction between mental health and teachers can be thought about in terms of not so much the health of the teachers, but the unique role of the teachers to be able to help in the mental health of students. And there's an obvious reason which is obvious to you but is less obvious to people like me because we don't often think about it, and that is that just how long and how deeply are you interacting with students And, you can observe things that I, as a doctor, seeing a patient maybe once a week at the most for a relatively short period of time, I'm not going to pick up as much as a teacher who's seeing the same student, 5 days a week for several hours. And so you have a unique opportunity to really make an impact. Next slide. So I think we'll just go ahead. Next slide. So, I think we'll use the same approach as we did last time. This will be a shorter survey, so you got to get your stickers out again and stick them on to any of these items that you think to be the single biggest barrier in mental health. Go ahead, and I'll give you another 30 seconds.
If I could just interrupt for a second, we have a new person who's joined us, Lorianne. And Lorianne, I think you're on a device from what I can see, so you don't have access to the clip art that people are using on the screen. So why don't you just number the bullets from the top to the bottom, 1, 2, 3, 4, 5, 6, and then you can just put the number in the chat that corresponds to the response that you would have given. I hope that works.
Okay.
All right, class, time's up. You turn in your papers now. Okay, so let's look at the barriers. So a few have said that other priorities are there. A significant number of people have said we're not sure where to go for support. A couple of people have wondered about the appropriateness of the support that is provided, whether it really works or not. And a huge number of people have said something about, stigma and the consequences, especially if somebody knew at work that I had the problem, what would that result in? So next slide. Well, stigma was the biggest thing. And here's a cartoon that gets at it, right? If we break a bone, we proudly show off our cast and say, sign it. If we get a bad cut, we proudly show our stitches off. When we get the flu, the modern world, you post it, right? But what happens when you have a mental health issue? Silence, right? And that's another way of thinking of the stigma. Next slide. So if we think about the challenges we face more broadly, there's actually, besides stigma, there's other aspects. Well, first of all, does the person who's not doing too well, do they even recognize that there's a problem? So that's one problem. The second problem is the stigma that we've talked about. And the third is poor access to care. So those are the three biggest problems. And then there's an additional question that we should have from a healthcare perspective, and that is, let's say somebody goes and gets help. Was it the right help? Was it a kind of treatment that was appropriate for that condition? There are certainly lots of people who suggest that this kind of herbal remedy or that kind of change in your life will be the answer. But even when we get more technical and we talk about, well, let's say we go to a psychotherapist, there are many different kinds of psychotherapy. Some are designed to specifically deal with, say, depression or anxiety, and some are more generally designed to promote, personal growth and all that. If you have depression and you go to a psychotherapist who's, talking more about general personal growth, they can still be supportive and helpful, but they're not going to be as effective as someone who's targeting the specific problem that someone has with a specific psychotherapy that has been designed to help with that problem. So this is another major problem that we have, that the solutions that we have for providing mental health care may not be actually mapping on nicely to the specific problems that people have. Next slide. So one approach to dealing with some of these barriers, like a lack of access to care, a privacy issue or stigma concerns, and the ability to check for yourself what's going on. In order to deal with these barriers, one possible solution is to use a tool that relies on an individual providing information privately and doing so over the internet, so they can do it whenever and however they want, and in privacy, and then come up with both some possible problems that can be defined for them, but also some solutions. So in that spirit, about 10 years ago, a number of North American experts, psychiatrists and psychologists, with some other experts as well, collaborated in creating this tool that you're going to hear about. There are two key principles in the creation of the tool. One is that in order to diagnose a problem, of course you need a human being to make a diagnosis, but you can use very good questionnaires to accurately capture key symptoms and key problems, so that the questionnaire will give a pretty good idea of what's going on. So use a validated questionnaire to figure out what's wrong. That's one principle. And the second is, if you're going to provide advice, make sure that the advice that is provided through this internet tool conforms to the best treatment practices. And so in creating this tool, that's certainly what we did. There are two major organizations, the Canadian Network for Mood and Anxiety Treatments, or the acronym is CANMAT there, and the American Psychiatric Association. Both of these organizations produce treatment guidelines, and those are the ones that we really use to guide the medical advice that is put in this tool. So we're going to hear more about this tool in a minute, but a couple of just final gems about this tool. When and if you choose to use this tool, you can do so anonymously at any time of day or night. You will get feedback. This feedback will tell you what you're at high risk of, like there's a good chance you might have depression, but you need to have it checked out by your family doctor or someone else you trust. So in order to do that, we provide through this system a letter that explains what was analyzed and what should be looked for, as well as a personalized action plan. So that's a number of suggestions for what you can do to help yourself, and also so that you know what a healthcare provider might say. It'll also give a cheat sheet summary of the best medication treatments, the best psychotherapy treatments, and the best other things like light therapy or exercise or whatever, and so that you know what the recommendations are, so that when you do, and if you do go to see a healthcare provider, you can say, I've already looked at the various options that are recommended, and I'm interested in light therapy, or I'm interested in cognitive behavior therapy, or I'm interested in Prozac or whatever, and you know that before the professional has to talk to you. So you're an informed consumer. So this system is available now to all OTIP members and their families. Next slide. Okay, so and that's where it is. All right.
Okay, so thank you, Dr. Parikh, for introducing, or really giving the context behind the motivation for Feeling Better Now. And as Susan has shared in the chat, and as Dr. Parikh already mentioned, this is already available to all OTIP members as well as your family members. So you'll be able to, if you'd like, follow along, create your own account now by going to feelingbetternow.com/OTIP. And if you're creating a new account, it'll ask for an organization. You can start typing in OTF, and it'll select for that. So what I'm going to do now is walk through a few screenshot slides of what the program looks like and really show you what the tool can really do. Our goal really is to create a mental health hub that will have all of your mental health needs. So, you can go to Feeling Better Now for evidence-based practices, for your for the gold standards in mental health practices, and really for a lot of information that would be difficult to find otherwise. Okay. So to the question in the chat box, if you choose another organization affiliate, that is not an issue. You'll be able to select OTF, OECTA, ETFO, or if you're a staff member, you can select other employee organizations. So that's just really for aggregated statistics that I can touch on later. Now, what we're looking at here is the sign-up site. If you went to feelingbetternow.com/OTIP, this is the site you'll have access to. So you see here you have two options. You can either create your account or you can sign in as a returning user. Now, one thing to note is Feeling Better Now does not ask you to identify yourself. So when you're creating your account, you'll see that it doesn't ask for any employee information. You don't have to put in your email address. It's only for password recovery, and it's all optional. You can choose to write your password onto a card, and if you forget that, you have unlimited opportunities to create new accounts. Of course, you'll be able to track what your assessments look like better if you're logging in with the same account every time. However, you're able to use this tool no matter where you are, and it doesn't have to be through the same account if you lose it. So it's really great in keeping to the anonymity, ensuring your privacy and confidentiality. And again, that's one of the ways that's one of our pillars, and that's one of the ways we're addressing the issue of stigma around mental health. Now, the page that you're looking at now is the logged in site. So for those of you folks who are following along, you'll see this page, and that's the first thing you'll see on your account. You'll have your dashboard across the top here. Let me see if I can show my little mouse. You'll see your dashboard across the top, starting with start an assessment, your toolbox, assessment history, support resources, and mental health problems. So it has everything from the assessment to information about mental health to looking at your history and accessing your resources. Once you get to use the program more, you'll find it to be more of a tool for yourself. We're not saying you have to do the assessment and then you can access the other tools. We're saying this is something that our goal is to empower you with, to allow you to engage with mental health and be a better informed consumer, and also be more engaged with your personal mental health journey. The main call to action is to complete an assessment. So you'll see here it says start an assessment. This can be relevant for everyone, for those who are feeling great right now, or those who need some support right away, or are going into the doctors tomorrow. This is applicable because, as Dr. Parikh mentioned, this is a really standard and medically based test, but it'll help you gauge where you are. So for example, it could be the middle of June, there aren't any students around, you don't have to worry about 30 kids around you. Instead, you're able to say, hey, I feel great, let me set my baseline with Feeling Better Now. So once you created that account and completed an assessment, you can say, this is where I am when I'm feeling really well. But then in September, or maybe in January, or when your IEPs are due and you're having to write those, you can go back into the program and see the changes through accessing your assessment history. So that's one way Feeling Better Now can really be a tool for self-check-in and for self-management. Now, the assessment itself can take anywhere from 5 to 20 minutes to complete. This really depends on how you answer the question. And if you don't have that time right away, you can always exit the program and return to it. The best part about the program is, I want to make sure that I'm explicit about this, it's available in English and French. So for accessibility purposes, it's AODA compliant as well. That's web-based accessibility. And again, to the point of being accessible, it's a web-based program. So it's not an app that you have to download and then you have to find it on Google or Apple Store and then download it and then put in your information. What about payment? none of that. You don't have to pay for it. It's a website. You put it into your URL, into your Explorer app or onto your Chrome app, and you'll be able to access it. So in that way, you're able to access it from anywhere and be able to pick up where you left off, whenever, wherever. So what we're looking at now is the first section of the assessment. We're not going to go through a whole assessment. Instead, we'll see bits and pieces. If you read the question, you see that it is a simple yes or no. What we've done is, with this assessment, we've become very comprehensive in it. If you went to CAMH, the Canadian Center for Addictions and Mental Health, they have a website and they have surveys on it. They have questionnaires that ask you, do you have depression? Take this survey. Do you have anxiety? Take this survey. So the problem with that is they already ask you to pre-select yourself. So they already ask, do you think you have depression? Okay, then you can take this. It really puts in a different mentality. Instead, we're doing a broader perspective. We're doing a general question, and there's 13 general questions. And just for reference, these are questions that refer to the cardinal symptom of each of the conditions that are covered by Feeling Better Now. And by doing it this way, we're able to identify any comorbidities or concurrent mood concerns. So that's saying, we're not just asking, do you have depression, but we're asking, what kind of mental health concerns do you have? We're not leading you, but we're able to identify different types. And just to know for Dr. Parikh, if you'd like to jump in, go ahead, if you have anything to add. So the point of that is being able to identify differences between different mental health conditions, but also being able to say these are the various concerns you have. It's not just depression and that's it, or it's not just substance abuse, that's it. We're able to say it's substance abuse, but there's also concerns with anxiety, there's also concerns with PTSD, and being able to be more holistic and paint a fuller picture. So this is in a continuation of those questions. You'll see that the answer selection has changed. One of the things that Feeling Better Now does is it generates an immediate personalized action plan. And this action plan has what you've indicated as concerns you have, so the symptoms as well as the frequencies, but it also, depending on the level of risk, help you identify what types of treatments would be appropriate for you to seek. Of course, with mental health, there are always concerns of potential harming of yourself or someone else. We have an immediate intervention that helps identify this. So if you do indicate, if the user indicates any level of self-harm or suicide ideation, there's an immediate crisis hotline that's a database that we've compiled of all of the crisis hotlines available in Canada. So no matter where you are, we can help you locate your region and find a call hotline near you. You can also call 911 immediately, and there's also options to view the support resources, so the other resources that are available through OTIP. Okay, so the next section here, we also have basic history information. This can be really helpful for people who are going to a new clinician. So if you're going to a walk-in or where it's just a different doctor, or you're going to a social worker or a counselor, you may be able to generate this information in the comfort of your own space. So we're asking any types of medication you may have taken, any previous diagnosis, and we also ask about physical as well as mental health concerns that you may have previously had. So one of the things that do get lost is the relationship between physical health and mental health. Now, when someone presents with, for example, lower back pain, and they've had it for months, that's the one thing that they can go to their doctor and be really vocal about. Say, I have lower back pain, can we do something about it? But because of that focus on the physical and the technically more tangible, we may lose the mental health aspect. Instead, by asking the user to provide these information, we're able to make that connection, because we've seen that chronic stress could be or can be very much tied with chronic pain. And as Dr. Parikh mentioned as well, diabetes and depression, or diabetes and anxiety or mental health condition is also a factor in the person's journey to getting better. So what we're looking at here is the completed page, a sample of what an outcome may look like. Now, as I mentioned, the whole program is about self-identifying yourself. If you want to provide your information, you can do some of that, but at no point would we be asking for your name. The most we would ask for is for your email, and this is either for an email reminder or for your password. So again, everything's completely safe. Your colleagues wouldn't know if you've used the program. If you've passed the URL to a spouse, you wouldn't be able to find out, we wouldn't be able to find out who that was, who's accessing this information. So I'm just going to read the question here in the chat box. It says, if you do an assessment on one date and do another assessment at a later date, do both assessments remain in your history? Nope, all of the assessments you've begun or completed will remain in your assessment history. So you'll be able to go back and see what types of changes there have been. So thank you for the question. So beyond the email reminder, as soon as you've completed an assessment, you really have three different options. First, you'll take a look at the messaging, and you'll see that it's a little small here, but it does say it sounds like you may be experiencing some symptoms of depression. Now, if you don't know what the condition is, you can interact with it. You'll click it, and a sidebar will show up, which will tell you a little bit about what the condition is. So this way, we're not losing you to Dr. Google, right? We're not saying, okay, well, we're going to say you have anxiety and you don't know what that, or that it looks like you might be concerned with anxiety, and then you'll have to go on the internet and find out what it is and end up on someone's blog. We've kept it simple. We've really made Feeling Better Now a hub. So your options here are to look at your personalized action plan. You can take a look at all the tools you have here, as well as the support options from OTIV. For example, some of you may be familiar with CarePath, which is another benefit that's offered through OTIV as part of your benefits. What we're looking at now is the personalized action plan for depression symptoms. So this person has, let's say this is my action plan and this is what I'm looking at. I have the option of emailing this through Mensante server to my doctor, and I can say, Dr. Liu, this is my assessment for tomorrow's meeting. Can you print it out? This is Kathleen. Right? I would have to say it's me, and I have to put in their email information, but at no point do I have to put in my information. So again, confidentiality is a key part of our design in this program. So you'll see again that this is based on evidence-based practices. The assessment that we saw is also based on the Diagnostic Statistics Manual. That's the DSM-5. Sorry, the full name is the Diagnostics and Statistical Manual of Mental Disorders. There have been a few editions of this, and since Feeling Better Now's inception, we've gone through one revision of that. So it went from the 4th to the 5th. So to make sure that our users, so that our teachers are getting the latest in medical practice and medical guidelines, we've made those changes as they come. And so at Mensante, we're really glad to have Dr. Parikh as part of our advisors, because he knows what the guidelines are, he knows what the changes are, and he's very critical of the information that comes out. And so that means the information that you see on Feeling Better Now is really well regarded, and it becomes the latest in this information that you'll have. And so you may have more information than, say, maybe your clinician who doesn't keep up with all of the news in psychiatry. So going back to the slide now, it says your symptoms and history, as well as all the information that you've put in as the end user. So let me paint a little picture here. Let's say I have some concern sleeping lately, and so I decide, okay, I want to go see my doctor. So I go in and I talk to my doctor and I say, hey doctor, I haven't been sleeping well lately. Would you be able to help me? Now, she might ask me a few questions, ask me a few questions about my lifestyle, about work, and after 5 or 10 minutes, she'll conclude, okay, Kathleen, maybe you should stop that subscription to Netflix because you shouldn't be sleeping at 3 a.m. in the morning. You know, that's really messing up your sleep pattern. And that could be the end of the conversation. Now, with Feeling Better Now, let's say I've completed an assessment, and instead of just what's salient in my mind, the program has asked me about every single symptom and every general concern in a way that I'm prompted to think about whether these symptoms apply to me. So now I've completed Feeling Better Now in the comfort of my own space, at my own pace, and I bring this action plan in. So I can say, okay, it seems like it's not just problem sleeping, because that was the only thing I was thinking about. But when I was asked about my concentration, yeah, you know what, I haven't been meeting many deadlines lately. Like I've been procrastinating, had been quite restless, and these other symptoms start coming out, and we're able to paint a whole picture. So now when I go to my doctor, I'm able to say, I took this assessment, and it's DSM-5 compliant, and this CAMAT and APA, and don't know what it is, and say, okay, these are the problems that it says I may be looking at. So then my clinician can then confirm this with me, and now instead of focusing on trying to figure out what the problem is and unsubscribing from Netflix, we're able to focus on a care path for me, a very personalized care path for my mental health. And the best part about it is I'm a leading part of it. I'm here to say, with all this information, I can say, well, these are the psychotherapy options that I want to take a look at, and these are the medications that I have some questions about. So then that becomes much more engaging, and I feel empowered to be a part of my mental health journey. One thing I do want to note that is Feeling Better Now, as Dr. Parikh mentioned, we're not looking to replace a clinician. This isn't a diagnosis. Just because it says you're at risk for depression doesn't mean you have it. You have to have a clinician to give you that diagnosis in order to take that next step. This is really, again, to help you be engaged with your mental health and have that information and be, as Dr. Parikh mentioned, an informed consumer. So you'll see here we also have medication options. Now, depending on how you've completed the assessment, depending on your answers, you'll have different messages that come out. You may not get any medication options because it's not appropriate for your level of risk. So again, we're making sure that we're not trying to push any drugs or trying to push a certain method, but instead we're trying to get you to look at what's appropriate for you, what would be the best option so that you can tailor your own care and really see the effects of this evidence-based approach. As mentioned before, we do have support resources, and you see here CarePath is one of them, and these are available through OTET themselves. So in addition to that, you also have a variety of tools. You'll see here you can have access to anything from stress reduction to learning about which care providers would be appropriate for you, to helping understand mental health problems, as well as helping others. And that's a communication framework that has been developed based on the Mental Health Commission of Canada and CAMH information for talking about mental health and talking to a colleague, identifying symptoms, and being able to talk about mental health with dignity and respect. Some of you may be familiar with these apps already. These aren't things that Feeling Better Now or Mental Health has developed. Instead of reinventing the wheel, we've taken a look at all the resources that are out there, and when it comes to technology and health, there's a plethora of resources. So as a single consumer, how can you possibly have the time to go through 2,000, 3,000, a million results on Google, or 3,000 apps that say they're all great for mental health? What we've done with our clinical advisory board is taken that whole process and done it ourselves. So we have a vetting process for ensuring that what you see on Feeling Better Now is evidence-based. It's proven to be effective for its purpose, and it's shown to work. One of the places that we look to a lot is Australia. The Black Dog Institute in Australia is a leading mental health, e-mental health resource provider. So there are some tools from across the country. And PTSD in the U.S., the veterans are, I believe, a leading source as well. And so we've really taken a few things. Some of them may not be free, but we've really taken a bit from everything. The other the other element to that is we know people interact with information differently. And in doing so, we've taken a look at workbooks, at books, at apps, at websites. Everything and anything we can get our hands on, we've asked our clinical advisory board to take a look at and see if this is fitting for our audience. And just to also mention, we're not being paid by any of these other companies to put those apps up. We've actually been approached by companies who say, we have a great product, can we pay you to make it available to your users? That's not how we function. We're not here to sell OTIP members, right? We want to make sure that what you're seeing really is trustworthy, so we've really stayed away from that model. Instead, we've kept to a very strict vetting process. So as I mentioned, we have a Helping Others section, and this section really is for understanding how to support those around you. There are also tools for supporting students that you'll be able to find under Helping Others as well as under OTIP resources, because a lot of the questions we get is really from not just an individual who is an OTIP member, but really from the teacher perspective. It's great, these resources look great, how can I use them for my students? Right. So we've really developed a few things to answer that question, although we'd really like to see a lot of teachers put themselves first as well. So one of the things that we've seen over time is every time we've gone to a conference or a workshop, PD day events like one that I'm going to tomorrow, we always get really positive feedback. We see people are using the toolbox. We see that the assessment's really useful for them. They're using it for themselves, able to pass it on to family members, their colleagues. And we're seeing a lot of really positive feedback from them. We're really proud that we're able to meet those mental health needs for your colleagues. But of course, part of that is we've been around for 10 years. A little over 10 years, and we're constantly changing. We're wanting to get better. We want to make sure that as you change, as the teaching space changes, we want to make sure we're meeting those needs. So we're always taking feedback. And with that, if you do have any questions, you can continue to write them in the chat. But I'd like to turn this over back to Dr. Parikh as he'll kind of contextualize a bit more too.
All right, well, this has been quite a bit of talking at you. So we want to have some feedback, and we want you to go ahead and answer the survey there about how well do you think you're taking care of your personal mental health. And while you're thinking about that, or if you've answered that, feel free to pipe in with some questions. Okay, well, I think we've probably gotten some responses, and maybe some people are taking care of their personal mental health right now by relaxing and not using an icon and not using the computer, and that's perfectly fine. But for those of you who've graced the screen with an answer, let me just respond. So a couple of us are keeners, and they're protecting their mental health well, right there at the top. Another couple are doing okay, and slightly more are in the latter categories of could be better. And I think if you're obviously looking for some information or options, I hope that you will consider using the Feeling Better Now option to explore a little bit about what you're experiencing, but particularly all the tools, including the self-help tools and the other kinds of resources that are there. So why don't we just go on to the next slide now. And this might provoke some more thought, and if it's easy to type the question in the chat room, I'm looking at that now as well. So this is about overcoming barriers, and we talked about some general barriers like stigma or access or other issues. Are there any other tips that anyone wants to share about some solutions? Like, oh, I've overcome this barrier by doing this thing or that thing. If you have some comments on how you've overcome barriers, feel free to type those in the chat function box there. I actually like this cartoon, and I hope you guys had a chance to look at it. I'll read it for you if you want to just sit back. So the stress management therapist is talking to the person sitting in the chair. You need to go home, take a long, relaxing bath surrounded by aromatic candles, and do an hour of yoga. But that's out of the question. How about a 5-minute smoking break? I just thought, yeah, that I think captures it. And next slide, please, Kathleen. Well, we do like to do these kinds of presentations in person, and when we do, we actually practice what we preach by doing certain breathing exercises, in person. I think it's a bit awkward when I can't see you, you can't see me, and I can't hear you or whatever. So we'll skip this exercise for now, but the advice on how to do these kinds of breathing exercises are incorporated in the Feeling Better Now option, but you can also just search YouTube. There are a lot of good YouTube videos. Just go to YouTube, breathing meditation. You'll come up with some, and you'll quickly decide, this one, I like this one, or that one, I don't like it. So, YouTube is actually a pretty good health resource. Next slide. So, I think we've already captured a lot of the sentiments that are here in this slide. Mental health is an issue for all of us. It's an issue for trying to ensure our optimal happiness and performance, but it's also an opportunity, particularly for you as teachers, seeing individuals for so long, seeing your students for so long, much longer than any doctor does. And also, one thing we didn't mention is that what is the peak onset? What is the time of onset of most mood and anxiety disorders? It's in the teenage years. Little kids have problems too, but not often, percentage-wise, not that many have serious clinical problems. But the first serious clinical problems appear in large numbers of people when they're actually teenagers. And so some of you, those of you who are high school teachers, you are the real first witnesses to those individuals in distress. And by the way, we in the healthcare field are trying to do more in schools. I'm involved with some programs here, and there are many such programs now being developed across Canada, particularly in Nova Scotia, which was a real pioneer in this, in terms of doing mental health training and teaching students how to be peer champions for mental health and so on, in the schools, so that you can both treat some problems that are milder right there, and by teaching better coping skills, you can prevent more clinical problems. Next slide, please. All right, Kathleen, I think I'm going to just turn it back over to you. I know, actually, you can put up the next slide, which is our reference slide. And here are some of the places that have additional resources. But YouTube is great for anything you want to learn. And of course, Dr. Google is the most widely used doctor in the world for all of us. So I'm afraid I actually have a teenage daughter that I have to go pick up from dance. So I am going to sign out and protect my mental health, because if I don't pick her up on time, I will pay for it, both from my wife and from her, and that's not good for my mental health. So I can stay on for one last question. If there's one question in the next 30 seconds, if you type it, I can
Yeah,
respond.
there was an earlier question that asked, do you suggest these breathing meditation after a difficult class, or before or at the end of the day?
Okay, so the breathing exercises in general, you can divide them into two things. There are things that you can do when you're feeling very anxious, and those are more general abdominal breathing exercises. And then there's meditation, which incorporates some breathing, but the primary thing is more the meditation focus. So if you're having acute stress, then capturing your breathing style at the moment, or shortly after you've experienced the stress, that's the critical time. However, if you're trying to, if you're not, in the moment of stress, but you've now come home and you're feeling the weight of the day, that's when meditation plus or minus some breathing would be recommended.
Okay, thank you very much. And I think that may be all the time you have. We want to make sure you're taking care of yourself too.
All right. Thanks, everyone.
Thank you very much,
now.
Dr. Parikh. We really appreciate your expertise and wisdom tonight. Great session.
Good night.
Okay, and I see we have a lot of great comments and conversation in the chat box. I just want to quickly address Stephanie G as well. That's a sentiment we hear a lot from the teachers that we talk to, and not being able to put yourself first becomes really difficult just because of the amount of responsibilities there are. But I think we can take a page from Seema's book and just being able to say, if I can't get something done, I'm just going to have to accept that it can't be done. Or being able to kind of find pockets of time. So one of the things that I like to do is, if I wanted to so I like listening to podcasts. And if I want to, listen to a podcast on my commute, I got to download that onto my phone just so I can play it while I'm on the subway. So if during your commute, that might be a good time to try out a breathing exercise and just see how that works for you. So really, it could be a different, it really works differently for everyone. I've been speaking to quite a few teachers, and one of them, her method is she takes kickboxing class. So instead of, yelling at her, instead of other simpler techniques, or instead of going on to Feeling Better Now, she really likes kickboxing. So exercise is her thing. It can be really hard to say, it's like the cartoon, right? It can be really hard to say, yeah, you need to do 20 minutes of yoga, half an hour of breathing exercise, eat right, and do all this. It comes down to picking and choosing, being able to find 5 minutes to do a little bit of something that really just puts you first. It can help. And if anyone has any comments as well, please feel free to unmute your mic and talk. I'm just going to read a few of the comments that I've scanned over.
And the slide that's up there right now looks like it has links. This is a screenshot actually of Kathleen's presentation, her PowerPoint. So when you receive a link to the resources, which will come tomorrow, you'll find all of these are live links on that resource page. I've actually got it pretty much finished now, so you'll be getting that along with the recording link in an email that comes from OTF tomorrow.
Great, thank you. Okay, do we have any other questions or any other comments that folks would like to make?
I can see that there are a couple of people that are writing right now. So perhaps what I'm going to do is move ahead to our next slide here and put a couple of links in the chat because people may want to look after this right now while they have time. So thank you very much for participating tonight, everyone. The two links that I put in the chat before, one is to a feedback survey, and OTF connects needs and really values your feedback. It helps them to drive their future OTF Connect webinar topics, and it also drives funding. So they count and collate the results of the feedback, and that helps to promote this webinar program for the future. The resource link is there. It says active by noon tomorrow. I will do that right at the end of the session tonight, so it will actually be active a little bit earlier than that. So thank you for doing the feedback. We really appreciate it. There are a few sessions coming up in the next I think next week is the final week for OTF Connects, but it's a busy week. There are a whole bunch of amazing things happening next week, and the winter and spring calendar is starting to fill up. So I put a link in there to the calendar, and take a look because there's a lot of great sessions in math, technology, new curriculum, kindergarten, and now they're offering sessions in wellness as well. Finally, I'm just going to say that if you're taking an AQ course in math, technology, or kindergarten, that there is still a subsidy offer of $450 or up to that from OTF. And if you go to the OTF website, you can get more information on that. I'm going to stop the recording, and if there are any further questions for Kathleen, she will be happy to respond to those. So thank you, Kathleen, for looking after the session tonight and sort of hosting it and bringing your colleague along too. That worked out really well with Dr. Parikh speaking into his tablet, even though he wasn't able to hook into the other. So thank you very much for making that happen. Really valuable topic, and I think that people who attended will be grateful to have these resources at their disposal. So thank you, everyone.